Most dog owners think a swollen belly means weight gain, liver disease, or maybe even cancer. But what if I told you that sometimes the real problem is the heart? Recently, I saw an older dog whose belly kept getting larger and larger. The owner was worried about fluid in the abdomen and naturally assumed it might be a liver problem. What we discovered surprised them completely. The problem wasn't primarily the liver, it was the heart. Today, I'd like to explain how heart disease can cause fluid to build up inside a dog's abdomen and what warning signs every dog owner should know. Many people know that heart disease can cause coughing, but many don't realize that some dogs develop abdominal fluid because of heart problems. The dog I mentioned earlier came to the hospital because the abdomen was becoming noticeably enlarged. At first, the owner wondered if it was a liver problem. Others had suggested it could be a tumor. But after performing diagnostic tests, we found evidence of heart disease, enlargement of the right side of the heart, and pulmonary hypertension. The fluid in the abdomen wasn't the primary disease. It was a consequence of what was happening inside the cardiovascular system. So what exactly is abdominal fluid accumulation? Veterinarians call it ascites. Ascites simply means fluid collecting inside the abdominal cavity. Owners often describe it by saying, "My dog's belly looks bloated," "My dog's stomach suddenly became larger," or "Something doesn't look right." Depending on the amount of fluid, dogs may also show reduced activity, decreased appetite, heavy breathing, or general weakness. Now, here's something that surprises many owners. When people hear the word ascites, they immediately think about liver disease, and that's understandable. In humans, severe liver disease is one of the most common causes of abdominal fluid accumulation, but dogs are different. In dogs, ascites can develop because of heart disease, liver disease, cancer, protein-losing disorders, bleeding disorders, and several other medical conditions. That's why we never assume the cause without proper testing. To understand this, let's talk briefly about the right side of the heart. The right side receives blood returning from the body and pumps it toward the lungs. When pressure builds up inside the right side of the heart, blood begins to back up within the veins. As that pressure increases, fluid can leak from blood vessels into the abdominal cavity. Over time, this leads to ascites. In some dogs, a swollen belly may actually be one of the first obvious signs of advanced heart disease. In this particular dog, we also found evidence suggesting pulmonary hypertension. Pulmonary hypertension means abnormally high blood pressure inside the blood vessels of the lungs. When that pressure rises, the right side of the heart has to work much harder. Eventually, the right heart can enlarge and become overloaded. This can contribute to fluid accumulation inside the abdomen. Common causes of pulmonary hypertension in dogs include mitral valve disease, chronic respiratory disease, pulmonary thromboembolism, heartworm disease, and certain congenital heart defects. One particularly important point involves heartworm disease. Many owners assume that once heartworm treatment is completed, the problem is completely gone. Unfortunately, that's not always true. Even after successful treatment, some dogs are left with permanent damage to the pulmonary blood vessels. That damage may contribute to pulmonary hypertension later in life. In some patients, pulmonary thromboembolism can also occur, creating additional strain on the lungs and heart. So if your dog has a history of heartworm infection, that history remains important even years later. At this point, some owners ask a very reasonable question: why not simply remove the fluid? Sometimes we do. If the abdomen is causing discomfort or making breathing more difficult, removing some fluid can help the patient feel better. However, draining the fluid alone does not solve the problem. The most important step is treating the underlying disease. If heart disease or pulmonary hypertension is responsible, those conditions must be addressed. Otherwise, the fluid often returns. Another important piece of management is diet. Dogs with heart disease and fluid accumulation often benefit from reducing excessive sodium intake. Salty human foods can encourage the body to retain more fluid, potentially making ascites worse. That's why dietary management often becomes part of the overall treatment plan. If your dog has a growing belly, persistent coughing, exercise intolerance, fatigue, breathing difficulties, or a known heart murmur, a heart evaluation may be warranted. Especially in older dogs, a swollen abdomen should never be ignored. A swollen belly doesn't always mean liver disease, and it certainly doesn't always mean weight gain. Sometimes the real problem is hidden inside the heart. If your dog's abdomen seems larger than normal, don't focus only on the belly. Make sure the heart is evaluated as well. Early diagnosis can make a significant difference in quality of life and long-term management. Thank you for watching, and I'll see you in the next video.